Well, thank you so much for having us. Very excited to be here. My name is Brittany Drum. I'm the Program Director of Wellbeing at Geisinger, and I'm joined by our nurse leader here, Dawn Snyder. She's an RN, MSN, she's a nurse specialist, and she's also our lead nurse peer supporter. So looking forward to being able to tell you a little bit about this program today.
Through the last several years, our nursing population has suffered in unimaginable ways. Our hospitals are bursting at the seams with capacity, and our care teams have twice the work they've ever had before and half the help. On any given day, a nurse could be punched or spit on, watch a close friend quit, decide whether to chart or give a patient a bath they need, be mandated overtime to lose another night of bedtime with their kids, and watch a patient they've connected with die. To those of us not in bedside nursing roles, this seems unthinkable. Underneath the workflow and staffing challenges, these incredible caregivers are experiencing emotional exhaustion, resounding grief, cumulative trauma, and moral injury. After analyzing data collected from rounding over a period of 2 years, representative of 4,500 employee voices, it was evident that burnout, trauma, and grief was where we needed to focus. Nurses are not given adequate time or resources to deal with the ongoing emotional exhaustion they're facing, and so we decided to bring a high-quality mental health resource to our nurses. Our target population is roughly 5,000 of our nurses, nurse leaders, and nurse support staff across all of our hospital platforms, with an additional 5,000 employees also experiencing the benefit.
Through this quantitative and qualitative data gathering, it was evident that peer intervention was well received as an emotional support mechanism, but pet therapy was the most requested program from our frontline population. Paws to Reflect combines traditional animal-assisted therapy with peer support. Certified therapy dogs and handlers will be partnered with peer supporters who are trained in psychological first aid to bring emotional support to the front lines. Our volunteer services division has a well-established patient-facing animal-assisted therapy program in place already. When animals are brought to the units, the feedback from the staff regarding their own well-being has been overwhelmingly positive. However, we have a lack of certified animals to provide support to the staff long-term. Additionally, we have a well-established peer support program, but having a proactive presence has been significantly more impactful than having an on-call support structure in our organization. Animal-assisted therapy alone has proven to be effective in reducing anxiety, depression, stress, and burnout in healthcare professional populations, and peer support programs have been proven to enhance well-being and psychological safety for hospital-based teams. The evidence for animal-assisted therapy and peer support independently are both strong, but bringing them together only serves to amplify the efficacy of both. The Paws to Reflect team will partner with volunteer services to identify and certify 50 dog and handler pairs by April of 2023. By June of 2023, Paws to Reflect would be implemented on all hospital platforms within the system. From a qualitative perspective, we want to utilize the rounding mechanisms we already have in place to solicit ongoing program feedback for the 2023 year. From a quantitative perspective, Paws to Reflect anticipates to reduce reported AMA Mini-Z nursing pilot burnout scores by more than 5% in our hospital-based nursing populations, as well as decrease the self-reported burnout and grief in the qualitative rounding data for the 2023 calendar year. While many competitors offer high-quality animal therapy, they lack the nurse centricity and peer support mechanisms that really bring Paws to Reflect together. We are requesting $35,000 to fund Paws to Reflect. In the first year, this money will be used to recruit 50 additional dog handlers with certification scholarships valid for a 3-year period. In addition to training and marketing, the funds will be utilized to acquire handler and dog uniforms, uniform accessories, supplies for volunteers, program supplies like pet safe cleaning wipes and ID lanyards. Our ask of $35,000 will not only create, implement, and sustain Paws to Reflect for 1 year, but it will largely sustain Paws to Reflect well into the future. We anticipate future annual program costs to be minimal. Years 2 and 3 costs are listed mostly contingent on volunteer turnover. Additional dogs may be needed to train, and extra uniforms and supplies will need to be purchased. We will continue to fund Paws to Reflect internally and elicit donor support as needed. But by certifying our volunteer handlers upfront in year one, we're investing in not just building a program, but an opportunity for our community to support our nurses in a way that feels tangible, fulfilling, and meaningful. From the frontline supervisors to the executive nursing leadership, our leaders stand behind this concept. Leveraging the established structure our volunteer services division has already created, we'll be able to implement and scale this very quickly. Our community members are actively seeking ways to get involved, though some don't have the means to support this financially. By implementing this program, we sponsor community member engagement that we otherwise couldn't have captured. There's already tremendous buy-in from the nursing staff. They're actively requesting the presence of pet therapy and peer support more regularly. Given these elements, we have strong evidence to suggest this will be a resounding success for our nurses. The Paws to Reflect team is headed by my colleague Don Snyder and includes several other leaders, both clinical and operational. There's a wide variety of licensure, age, expertise, and gender and background on the team, all with a unified commitment to this work. Our nurses are incredible. We know that EAP is not enough to support the trauma, grief, exhaustion, and moral injury they face every day, especially amidst the staffing crisis. We also know that resilience mechanisms that keep them coming back every day make them resistant to seeking support. Paws to Reflect can change the narrative on how well-being care is delivered literally. By softening the walls with a sweet puppy and bringing the support and connections to them at the front lines, we have the opportunity to give these teams a new path to support, one lined with paw prints. Thank you so much for the opportunity to present to you today.